Good morning, all. I'm going to start the meeting on time, hopefully end on time. This is my want. Deborah Goddard, Acting Secretary of Housing. Welcome to everyone that's here from our departments and from the public. Interagency Council on Homelessness, as you know, was created by statute with the idea of a whole of government response to homelessness. The department is charged with coordinating the work that goes on within the state in this arena. And sometimes we don't know everything that is going on. And I don't think everyone here knows everything that's going on. So we wanted to start, this is the second meeting this year, but we wanted to start, so to speak, with everyone putting forward something they can do in the arena of preventing homelessness, something we can all learn from, and our charge is to start coordinating that with all of you, our partners. So thank you for being here at 8:30. We realize there's a little glitch with the building not open until precisely 8:30. We will have to adjust something. That was my call to order. We'll move to roll call.
Yeah.
Here, Department of Administration.
Here, present.
Housing Resource Commission. Leah's here.
Present.
Department of Human Services. Department of Health. Department of Children, Youth and Families.
Present.
Department of Behavioral Health Care, Development, Disabilities and Hospitals.
Present.
Department of Labor and Training.
Here.
Department of Corrections.
Here.
Department of Elementary and Secondary Education.
Here.
Rhode Island Housing.
Here.
Emergency Management Agency.
Present.
Division of Veterans Affairs.
Here.
Public Defender's Office.
Present.
Medicaid Director.
Here.
Secretary of Health and Human Services.
Present.
Office of the Lieutenant Governor.
Here.
Providence Veterans Administration Medical Center.
Here.
Homeless Advisory Council. That's you. You're from the Homeless Advisory Council, correct?
Sorry, what?
Sean.
Homeless
The
Advisory.
VA Medical Center.
Oh, okay. Okay. I misread. Yeah.
I'm sorry, I didn't quite catch
I
that.
misread tabletop.
Excuse me.
Oh, absolutely.
Yes.
I wasn't called.
Office Healthy Aging. Yep.
Oh, I missed you. Sorry.
Okay.
Any other mistakes, omissions? Okay, we have a form as we can see, so that's great. Review of the minutes. I apologize if you did not get them before today. We will get a little bit better at this. Any changes? A motion to move to approve?
So moved.
Second? All in favor?
Aye.
Any opposed? Sustained? Abstentions?
Abstain.
Carol? Thank you all. Okay. Let's get to the meat of the meeting. Our whole of government approach to homelessness. Starting appropriately with the department. As I stated before, we are the lead agency for housing and homelessness and community development. We manage and implement the Consolidated Homeless Fund. I don't think that's news to anyone, which included the one-time funding from pandemic recovery. We work with the Housing Resource Commission and their funding. Title 20, which is MOU over to us, and the Social Services Block Grant Funds. This year, that represented more than $30 million going into homelessness services and shelter provision. We all know that this is not the amount of money that we're going to have in years going forward at the end of the one-time federal money. That's why it's also more important that we understand everything that's going on in the system. We maximized existing shelter resources, and we went from a system where we had some winter or seasonal shelters that opened and closed to year-round shelters, having heard that from the providers. Particularly as our climate changes, summer can be almost as brutal as winter in some days. We also have our municipal homelessness support initiative, which opens winter emergency hubs. We work with our municipalities to cover some of their costs. What we really want to focus on with everyone here, what we're focusing on, what my focus is, because of the coming change in fiscal reality, is to strengthen homelessness prevention and response. And we have built in strong performance management requirements into our contracts this year that relate to these goals in terms of how are we catching people before they fall, if they fall into homelessness, how are we addressing their opportunity to get them back into stabilized, safe, secure housing. That's our goal. So we're going to start going down the submissions from all the agencies, and thank you for filling out the template. One agency is going to talk 4 times as fast because they sent 4 slides in. Michelle. But really, let's just start, and let's be succinct but fulsome, if that's possible. So, Rebecca.
Thank you, Secretary. The Department of Administration has the distinction of being one of the more enabling forces in state government. By statute and by regulation, we don't directly impact housing, but we can directly impact the contracting for services, the financing of some of the transactions or the projects. We obviously serve as a human resource capacity on a number of these councils, boards, and in support of other initiatives within state government. However, through our divisions, we do directly impact the development of, or the siting of, or the support of affordable housing production, primarily through the Division of Planning, which operates the state's GIS system. The Division of Planning is also responsible for supporting the comprehensive local plans for cities and towns, and those local plans set recommended, amounts of affordable housing development among cities and towns. So in a way, the Division of Planning provides the parameters for city and town development and retention of affordable housing. So that's a very high-level summary. Happy to take any questions.
If there are 1 or 2 questions that are going forward from the members of the council. Okay, and let me pause for a moment. The governor is not able to be here today, but he is represented ably by Kate Crowley. So, thank you. Welcome. Department of Human Services. Not present.
The director's meeting, so I believe she's running late.
Okay, sorry. Do you want to come back to this?
Yeah, we can come back.
Okay. Department of Health. I'm sorry, let me go to DCYF.
Sure, thank you. So the department is charged with being a very prevention-focused agency as well as addressing child abuse and neglect for the purposes today. Our goal is really to help families who are at risk of homelessness to find opportunities for wraparound services, to support them in the community and keep them back in their homes with their families. However, we have over the past couple of years taken on a more active role, largely with some of the crises back in 2023 with the then very full staff that we had. So we have now about 102 families that we are providing hotels to, both directly through DCYF and our community partners, the Family Care Community Partnerships, have a cost of about $7 million, which up until this year was not included as a line item in our budget. This year we are proposing it as a line item in our budget. And we also provide 25 in collaboration with Rhode Island Housing, Family Service, Rhode Island, and some other partners. We provide 25 Family Unification Program vouchers That's the max that Rhode Island Housing was able to obtain in that competitive grant cycle in 2023. So we're maxed out with that. We also, and then 3 young adults, so there were 28. We kept 3 for young adults and the rest for families. And we also have foster youth independence vouchers with several housing authorities, which are listed. And we're supporting, since the inception, 50 youth in those programs. Again, given what's happening in Washington, we don't anticipate more opportunities there, or many more opportunities there at this point, but we could be wrong. And then we have 95 youth who we're supporting in our voluntary extension of care services. On the resource side, we have our support and response unit, which is an internal assessment and referral unit that families can call for supportive services. It's not intended to be a housing resource. It's intended to help support families in their home and keep their families together. As well, that is what our FCCPs were designed to do. Again, they were not designed as a housing resource, but we've had to lean on them heavily for that purpose. And then we have children's behavioral resources available, as well as others that are, without getting into 4 slides.
Any questions for Mike? Okay, next.
Good morning. The Office of Healthy Aging has no explicit requirements or obligations or direction related to housing or homelessness, either in our state statute or through our primary federal funding source, but housing remains the highest, largest issue raised by older adults as we talk to them in the community. In that lens, and in the lens of the slide, where we sit in a homelessness space is really, we can provide some services that can support prevention. So through our case management services, home care services, connection to legal services, we can support people who may be at risk of eviction and often receive those phone calls and provide those services. We additionally are able to fund emergency placements for respite and emergency placements for victims of elder abuse at certain times. And then again, as we don't explicitly have any charge related to this, our resources, though, I think come to play in the space of convening and ensuring that the voices of older adults are available to be heard and are brought together to make sure that we're having strong relationship building with older adult serving organizations, including with housing entities. We have good relationship with resident service coordinators, elder housing, and that the services that we provide can provide some wraparound supports and do sometimes provide wraparound supports for preventing eviction. I will say that because this is so important, whenever we have opportunities to support housing more directly, we take advantage of that. We have a small amount of somewhat flexible funds available for grandparents raising grandchildren, which we worked with DCYF over the last couple of years so that if they had a grandparent with a kinship placement who was at risk of, who is housing insecure, they could turn to us to get some support for utility payments or a month's of rent. It's definitely not a solution in any way, but it's a stopgap that we're happy to play whenever we're able to. And if I could just add one thing based on what you said earlier, I just wanted to note that when it comes to weather-related deaths, the most likely cause of death in a weather-related death is heat, and that heat is specifically for older adults. So as we consider winter shelter, I think as a state we also need to be considering that it's not just the 15-degree weather, it's also the 90-degree weather that is equally dangerous for unhoused people.
Rich? 4 slides?
Really, Rich?
Well, we deserve the attention. So for many decades, BHDH and its predecessor organization has been very involved in providing resources to the homeless community due to the correlation of people being with healthcare issues and homelessness. One causing the other and going both ways and needing to address that particular social determinant of health before you can address a lot of the severe issues around mental health or addiction treatment. There's been a history of support through the Thresholds program, collaboration with Rhode Island Housing, supporting nonprofits in applying for 202-811 funding, and now that particular housing start, which is substantial, is in need of some attention and repairs. So it's another source of focus of making sure we don't lose what we currently have through the federal initiatives of a couple of decades ago. In addition, through a lot of our clinical programs and other approaches, we provide on-site clinical and case management support to people who have challenges in maintaining their housing as well as other aspects of their lives. So that's a key component of what we have, and I'll turn it over to Michelle, who'll go over some of the details in each of the 4 slides.
So this will be quick. We just want our PowerPoint to be as long as our name. So basically, at BHDDH, we feel that housing and employment are the foundation for recovery. So the reason why we have 4 slides, and we don't need to go over the detail, but we wanted it for the record because there was a lot of things happening. And like the Office of Healthy Aging, the people who we serve need housing to be able to live in the community and thrive. So we are able through SAMHSA, the Substance Abuse and Mental Health Services Administration, to apply for grants. There's a PATH grant that is provides funds for outreach for people who are serious and persistently mentally ill. We have a RISEN grant that is looking to assess individuals who are either outside or in shelters or living in public housing to see if they need access to behavioral health services, which is critical. It's just starting, so we can't talk about it. You all know the purchasing rules, so we're just going to end it there. The next slide, just talks about our recovery housing program, the number of beds we have, and we are in the process of signing an MOU with the Department of Housing to create additional recovery beds. We partner with Rhode Island Housing. This is a new partnership. They have an 811 program for individuals with disabilities between the ages of 18 and 61, so we ensure services are there. That's the most critical piece that BHDDH and every EOH agency can play, because what keeps people in housing are the supportive services. We also partnered closely for at least 8 years with the Medicaid division to bring in home stabilization services, and we work with them, myself and Robbie here, oversee like the applications and do some training and support for the providers. And again, the Certified Community Behavioral Health Clinics, Director LeClaire is a national expert on that. They included Housing First, which is like a service philosophy that is used to keep people, especially experiencing chronic homelessness, in housing. So that is part of that. They started in October, so we're hoping as they move forward, we can really do some great work with the Department of Housing to ensure that when people are housed, they stay housed, and we can identify the different programs we can connect people to. And Thresholds is a program that we've done for years with Rhode Island Housing. We've used our funding to help integrate supportive housing into larger affordable housing buildings. Over 500 units were created. I think over 600 units were created, and now because our funding has decreased, it's a program just in the Division of Developmental Disabilities, so they're using those funds to prevent people from losing their housing and repairing some of the buildings that the director spoke about. Oh, and then the CCDHC outreach, I think I already addressed.
Also want to note that given the discussion of the last few days, a substantial portion of these funds come from the federal government. So hence the nail biting that goes on for everybody here.
Department of Labor and Training.
Thank you, good morning. The DLT's really in 2 spaces here. In the first space, we provide temporary income support through unemployment insurance, temporary disability insurance, and temporary caregiver insurance. That money, for instance, for unemployment during the pandemic, we put $4 billion into Rhode Island's economy. That money getting connected to people efficiently and effectively can help them in a great deal, and it really helps us do our job well. Of course, they're income-based, so if people don't meet earnings requirements during the last, say, 18 months or so, it's tough to get them approved. With the unemployment program from time to time, based on different federal actions, there are programs that people can qualify for. Right now is not one of those times. I don't know what the future of that looks like. The unemployment program is funded by the federal government. The benefits are not, but the administration is. So that is something that we're concerned with. Temporary disability is not funded that way. It's a restricted receipt account. On the other side, we work to get people connected to our economy, and that means helping people get connected to job opportunities, whether it be through job training, job counseling, career coaching, using our one-stop delivery centers in West Warwick, Woonsocket, and Providence to get people connected to jobs. We do that every single day. We have federal and state resources that do that. On the state side, the governor's budget has significant resources to help people get connected to opportunities. On the federal side, we'll see. That's a challenge that we're facing at the moment, like everybody else. During the pandemic, with the Office of Post-Secondary Education Commissioner, we set up the Reconnect program, which allows people that are in job training programs or connected to a public workforce system or now in higher ed to access much needed wraparound services. In the past, people probably thought that meant they'd get like bus rip tickets for the RIPTA or something else. It's not. It's individual needs up to $4,500 per person. We've done things like pay for housing costs that maybe people are in arrears on rent, pay for food and groceries. We've removed tattoos, done all sorts of stuff to help people get connected to the economy. That's a big part of the governor's plan going forward, and it's still part of our budget.
Any questions?
I see a footnote on the slide that says 123 road dogs participants identified. I'm just curious, what is the universe?
Much bigger. I mean, probably in that year it was probably 6,000 people, and they self-identified.
Yeah.
So and we do direct fund. Like for instance, Crossroads is a agency that we direct fund for different programming. We direct fund Amos House, and some other groups that deal specifically with people that are facing homelessness. But that was just one data point we thought was important to pull out.
Thank you.
Department of Corrections.
Well, good morning, everybody. So, as everybody's aware, I mean, the Department of Corrections isn't directly linked to homelessness, but we have a lot of folks that come into our facilities that are homeless and do not have employment, so on and so forth, prior to their incarceration. At the department, our mission is to rehabilitate folks and provide them skill sets and opportunities to education, medical substance abuse training, mental health services, medical services, transitional services, and things alike. We work a lot, much like with DLT, our community partners, Crossroads, Amos House, Open Doors, to provide opportunities when folks are going back out into the community to ensure that they have the opportunity to have housing. But much like our friends in the community, we have limited resources, and much like the agencies around the table that are sitting here today, which affects our ability to deliver services to the people that we need to. With that, we have over the last couple of years really focused on a recidivism reduction, and we're on a mission to do that. And in order to do that, it is improving the services within the Department of Corrections to ensure vocational and educational training, aligning ourselves with the Department of Labor and Training, having job coaches, to ensure that we're giving folks the skill sets that make them successful when they get out to get gainful and meaningful employment, and getting housing set up for medical services, mental health services, continuity of care as they get released, because 66% of our population have diagnosed with mental health issues. So it really is a challenge for us in order to link those services. Just yesterday, I was down at Providence Superior Court, and some of the ideas that came up as part of our reentry is that we don't have a reentry coordinator in the court itself, but yet we have a reentry services unit that is on the Pastori complex that deals with folks getting released. But there's a population we're missing that is getting released from the court that maybe needs these services and may not need it, but it's an opportunity to check that box, because there may be some folks that go out that door and end up on the street. So there's a lot of things we've been working on the last couple of years, and then much like Rich, he has Michelle, I have Chrissy, and Chrissy's going to talk about a lot of initiatives that she's worked on over the last couple of years as far as the external agencies and the linkage with those agencies to kind of help impact the homelessness issue.
Thank you, Director. Thank you, everyone. It's a pleasure to be here today. Perhaps the biggest step that we took was starting to sit and having conversations with our sister agencies that are here, most of them that are here today, to begin to look at some of the systemic challenges that we face for example, assisted living, nursing home, group home placement, right? We're talking about specific populations that face significant barriers when they re-enter if those placements are not available. working with DLT to have job coaches come into the facilities to be able to make that connection to employment and do a warm handoff to continue working with them post-release. With BHDDH, we've had several things that we're working on, such as group home placements and respite. Currently, we're in the planning process of, as Michelle spoke about, CCBHCs, which really bring that connection to access to housing, as well as mental health, substance use needs for the population. So bringing that into the facility so they're able to come into the DOC. So instead of just doing a referral and sending folks with information out the door, that those individuals from those agencies are able to come into the facilities, make the connection with those individuals, so when they return into the community, they already have a connection to those agencies. Thank you, Director. With OHHS, we've been working on the Justice Involved Prevention Initiative, which was to assist individuals who are leaving the DOC who are going to be homeless, that may need basic items, right? So we think about leaving prison, but where's the next meal going to come from when you're leaving at 1 in the afternoon? Where is the next, where you're getting your deodorant, your toothpaste, where's that going to come from? So this has given us the opportunity to pilot having those basic needs at hand and expand that now more into the facilities or even into the probation offices, so that we're able to have, folks can have access to basic items instead of just leaving empty-handed. Pay for Success, as you all know what the program is about, to identify and provide wraparound services and housing assistance to the highest utilizers between highest incarceration, housing, and medical systems. And we continue to be strong partners in that. I think right now, James, if you could refresh my memory of what the numbers are of enrolled individuals in Pay for Success and individuals that have been housed?
Sure. So we are about, I think it's over 75 individuals who've been engaged. A portion of those transitioned to other settings, and then we've already housed, I think, 17% as of yesterday.
So that's success, right? It's something that's been rolling out. We started about a year ago to really be partners in that because of the focus to assist those highest utilizers in population that needs to be connected back into the community. We're also partaking with respite with the behavioral health population, specifically focusing on SPMI individuals who would otherwise be released to homelessness. Healthcare enrollment and benefit enrollment is essential for somebody who's leaving the facilities if they're going to be homeless to be able to have access to that, as well as with DMV providing state IDs, and now we can do duplicate driver licenses, right, which is important when somebody's leaving, trying to start a job, trying to get anywhere in those situations. We work closely with the Department of Division of Veteran Affairs and the VA, consistent ongoing case management meetings to address the needs of folks that are leaving the DOC that have been veterans, so that there's coordination of services and they're given the opportunity to enroll in veteran services and assistance. And being part of the Olmsted Plan Development, one of the agencies that's involved in that, and also connecting and working with the community. So we need to be doing two things. One is to be working with the agencies that are here today into how we're addressing the needs of the homeless that are leaving the Department of Corrections, but also with community partners and continuing to build those relationships as we have with Amos House. And I just, when I look at this, just examples of Amos House, Open Doors, Crossroads, agencies that are at the table, and there are many others in the community that do assist and work with the justice involved population.
Questions? Thank you. Okay. Department of Ed.
Hello, everybody. At the Department of Education, our charge is to ensure that all of our homeless students have access to the exact same high-quality educational opportunities that their peer students do. That is our charge, and that is also our legal obligation. Many of the agencies around this table have also taken part of our chronic absenteeism working group. Step one is to get our students in school. And we see that homelessness has a significant impact on student outcomes. Over 60% of our students, approximately 60% of our homeless students, are chronically absent, which should not be surprising. And over half of those students are missing more than 20% of their school year. That's a number we absolutely need to reduce and get down. We know this is having an adverse impact on their student outcomes. There's about 20 percentage point gaps in terms of our state assessment performance between homeless students and their peer students. So when thinking about actions on the Department of Education's end, 3 key items come to mind. First, we are working with every single school system to make sure that they have a well-trained homeless liaison who can implement direct solutions and support their homeless students within their respective communities. We provide ongoing robust training to those school districts and the liaisons. We have about $450K of federal McKinney-Vento funding that we award on a competitive basis that goes about to 7 to 8 different school districts per year to help fund unique and innovative programs. In Warwick, they launched a Warwick Cares app, which directly connects families with real-time services. In Providence, for example, is supporting a partnership with Crossroads to provide wraparound students to meet the needs of students, wraparound services to homeless students. Lastly, on Rides In, we also are responsible for a statewide transportation system. We need to ensure that all of our students can actually get to school, and so we spend significant time and energy investing in our statewide transportation system. That number of homeless students participating in our statewide transportation system has increased by about 600%. The cost is roughly $5 million per year. And so we're working with our school district partners and so our government partners to figure out how to be more efficient, to get students, no matter where they live, to school that is the most stable environment for them, and ensure that they are successful in their school environment.
Questions? Okay. Thank you, Rhode Island Housing.
Thank you. Rhode Island Housing is the state housing finance agency for Rhode Island. There is one of us in every state across the country. And I like to think that we have played a major role in helping people avoid homelessness, keeping people in their homes while also providing services and housing for people who are experiencing homelessness. And we do this through a number of different programs. One of our largest programs in our leased housing area, that's where all of our rental subsidy programs are housed. And we've been very aggressive about applying for any new voucher that is available to bring into the state of Rhode Island. So we have almost 1,500 housing choice vouchers. We have 811 vouchers that have been discussed. We also have secure cash vouchers, the Family Youth Initiative vouchers that we work with Mike on. So working collaboratively with Mike's area, we're able to aggressively pursue whatever we can bring into the state. In addition to that, we have a project-based voucher program, and we're able to actually insert these vouchers into developments that are being built across the state of Rhode Island, and it's really a permanent subsidy. The voucher stays with the unit, it doesn't travel with the individual, so it's a permanent home for folks. We have a number of strategic initiatives that we pursue. We are the collaborative applicant for the Rhode Island Continuing Care, and we serve in that role since the inception of the program. We actually have $4.9 million that we invested from supported housing to serve 220 households. A grant that flows to Rhode Island Housing under the continuum. The state overall has over $17 million that comes in annually to help prevent homelessness and to end homelessness in our state. And a unique initiative that we were able to pursue was Robert Wood Johnson grant, which allowed us to create a toolkit to pair medical resources and services with housing. And it's a housing pilot program that's happening right now with Women's Development Corp and Wood River Health Clinic. So we'd like to replicate that across the state. We do have a one-stop application for all of our development programs, and I think that allows us to move quickly to get units built. It's one thing to have vouchers, but you actually have to have units that people can live in. We know that we desperately need many more housing units in Rhode Island. So the qualified allocation plan, which is our most robust tool to create rental housing in the state, has incentives for folks experiencing homelessness, priority points, and folks are stepping up and incorporating affordable apartments for folks at extremely low incomes. And then we have programs that support capital, operating, and services. In terms of resources, As I said, we aggressively pursue everything we can to bring into the state that's available to us to create more units to support people to be successful where they are housed. Our strategic initiatives, our homeless response system training for providers, leverage resources to help us be competitive on a national level, increases for our permanent supportive housing program as I discussed. And we have to continue to provide preferences within all of our funding programs to ensure that we're able to address the housing needs of our most vulnerable Americans.
Thank you, Carol. Questions? Okay, going to move quickly on to emergency management.
All right, so we're on emergency management. We've been involved with this. We've given one of our Dave Chanel over to help with this initiative. We've also worked with, we're using our webpage as a central repository for any warming centers or hubs that are active in their places and locations and times. And we're also directing a lot of people to our webpage, to that link, working with the state's public affairs people or external affairs folks to make sure that they're all messaging the same thing and have the correct information. As you can see, we also, on the other side, we stay in contact with all the emergency management directors for each city and town that may be operating a warming center or a hub. We provide any kind of equipment or supplies if they need it. We're in constant contact with them. So we've been providing certain things. If they need extra cots or whatever, we'll get them out to them. That's why we stay in contact with them continuously through our normal disaster response situational tools that we use. We're also in the process of rewriting parts of the cold weather protocol for the governor. So we kind of head that out. We pull different, our Director Pappas pulls in the different directors and kind of goes over what the policy should be, along with the secretary, to make sure we're kind of focusing on the right areas. And then we coordinate assistance through the local emergency management directors, because they know their area and the people in their towns, cities and towns better than we do. So we always use them as our sounding board for anything related to homelessness or even in a major incident. And again, we continuously are connected to the National Weather Service, along with the meteorologist at the Department of Environmental Management, who runs all his weather models for us. And as soon as we know the weather's going to be better, we start sending out weather to all the directors as well as the governor's office to make sure everybody's aware of what the temperatures are going to be going. And they have a lot of modeling, so they can project, every 5 to 6 days out what the weather's actually going to be. Again, I just want to, every time I deal with the weather people, I have to add this little caveat: weather's not an exact science. So, but they try and make it, and they do a pretty good job at it. So that's kind of what EMA does dealing with the homelessness part of it.
I'd like to speak up. I'm very upset with people being homeless and being frozen to death, sitting at a bus stop and nobody stops to check on them.
Excuse me? We're going to try and get to public comment after we move through whatever.
That's fine, but I wanted to make that statement.
Okay, thank you. We're going to move on. Do you have questions?
Just a quick comment.
Okay.
I just want to say that working closely with Wes Moore, Chief Arone is the emergency management liaison. And I just want to say he is a great example to maybe model across the state. He's looked for a warming space with us. He goes out, I've gone out with him looking for buildings to use for permanent supportive housing. I just think he plays an amazing role and think it could be replicated across the other communities.
Thank you, Michelle. We agree. Office of the Public Defender.
Thank you. So the Office of Public Defender is the largest criminal defense firm in the state. We have 58 attorneys representing adults charged with crimes, juveniles accused of being wayward and delinquent, and parents who the state is seeking to terminate their parental rights. Every person who is arrested and brought before the court is asked if they have an attorney, and if they say they do not, the court asks them if they can afford them. If they indicate that they cannot afford one, they are referred to the public defender's office, where they are interviewed for financial eligibility. In order to qualify for public defender services, the defendant must be indigent. So 100% of our clients are indigent. Many of them are on the brink of homelessness. Many suffer from mental health and substance abuse issues. The first thing that we do is we are on the front lines in the arraignment courtroom and the pretrial courtrooms. And we see far too often that clients are made offers to dispose of their cases and plead guilty for sentences of 30 and 60 and 90 days. Or we deal with clients who are being presented as bail or probation violators, and they are ordered held without bail for a period of 2 weeks until their next court date. Those 2-week holds, those 30, 60, 90-day sentences are devastating to these families of these clients that we represent. Oftentimes no incomes in the house or one income in the house, and the one income parent is now ending up held without bail for 2 weeks or serving a 30-day sentence. They are now losing their job. They now have an additional criminal record, and it makes it very difficult for them to maintain housing. So the first thing that we do is we try to eliminate these short sentences of 30 and 60 and 90 days, which are not going to rehabilitate an individual in a short period of time, and instead are just making their situation worse. When we are resolving these cases, we have a team of social workers. We have 7 social workers. 25 years ago, the man who hired me, John Hardiman, decided to make our office a holistic office, modeling after the Bronx Defenders, where while our main task is to represent those charged with crimes, we want to reduce recidivism. We do not want to see our clients again and again and again. So our social workers help to address the mental health issues and the substance abuse issues and the homelessness issues to try to address the root cause of why our clients are coming to see us and why are they getting charged with these crimes that are resulting in 30 and 60 and 90-day sentences. We have a community outreach liaison that we created about 10 or 15 years ago, who's an attorney but also part-time works with the community. A large part of that individual's task right now is expungements. People have far too many convictions on their record for things that should not prevent them from getting employment. Things like operating on a suspended license or having 3 or 4 misdemeanors from 10 or 15 years ago or preventing folks from getting employment. We've had a lot of success with our legislative efforts expanding expungement rights. And we now have attorneys who are on the front lines in court accepting calls from clients who are seeking to have their records expunged, but we're also getting out into the community. We meet with justice assistants every month, and every month there's a sign up, and there's about 30 folks who show up to file for expungements, to have court costs waived. We're expanding that into the Woonsocket Education Center. We're working with Project Weber, and we also work with the 134 Collaborative at Matthewson Street Church, where we are every Friday assisting with their meal delivery. And the last Friday of every month, we have an additional attorney there to answer basic questions and also expungement questions. We've been instrumental in trying to get criminal justice reform when it comes to court costs. Court costs can be thousands and thousands of dollars for folks that are in the criminal justice system because they don't have any money to begin with. So a few years ago, we were very supportive of getting court costs waived, and there is now a financial form where folks can ask that their court costs be waived, and they have to fill out a financial assessment of their liabilities and their income. But one of the boxes on that form indicates if you are represented by the public defender, you need to fill out nothing else on this form. Those court costs are waived. So we're saving our clients thousands and thousands of dollars to try to help them maintain housing while also trying to address their substance abuse and mental health needs to prevent them from coming back into the courts. A lot of our lawyers tell their clients at the end of the case, I hope to see you again, just not in this building. And that's a big part of our goal, is trying to represent them and protect their rights in the individual case, but ensure that they not come back into the court system again.
Can you define indigent in like 15 seconds or less?
125% above the federal poverty guidelines.
Below.
Below, sorry,
Okay,
yes,
thank you.
yes.
Thank you. Okay, UHHS, including Medicaid.
Good morning, everyone. In an attempt to be brief, I'll just share that the Medicaid program and EOHHS work with our sister agencies, many of which you've heard of already, or from already, really to prioritize housing as one of the foundational social determinants of health. To do that, our mission really is around preventing homelessness, and how we do that is making sure our key populations are housing ready, that they're housing retained, and that the systems are supportive of these populations. And that includes our healthcare system finding alternatives to discharging to homelessness, as well as thinking about how we make and provide technical assistance to ensure our shelters and other living arrangements are harm reduction friendly, accessible for our populations with disabilities, and a whole host of other things. We have a variety of programs that we have implemented and continue to do in partnership with most of the agencies here, whether it is within the EOHHS umbrella or with our colleagues at the Department of Housing, at the Department of Corrections, and others. And we continue to work and support our locals by mapping out our resources that we have available for supportive services and wraparound services on the local and municipal level. I'm happy to take any questions.
Questions? Thank you for that. Good. Office of Lieutenant Governor.
Good morning, everybody. So the Lieutenant Governor is the chair of the Long-Term Care Coordinating Council, which is concerned with coordinating state policy through all forms of long-term care throughout the entire long-term care system. So this is especially important in this conversation. We're looking at the growing number of older adults and folks in the long-term care system who are at risk of becoming unhoused or who are currently unhoused. So we're looking at everything we're doing with long-term care through housing and homelessness lens, like a lot of folks are. In terms of resources, not a lot of dedicated resources from our office, but I think where the Lieutenant Governor can provide the most support is as a convener and as an amplifier of messages, whether it's to the community or within state government.
Questions? Thank you. And Sean.
Yes. Just want to point out my slide is slid, not due to budget cuts, because I want to keep it simple for myself. One of the big ways in which we outreach veterans is through our national call center. So myself and my two colleagues, conservatively, I know PR, you got to go big, but conservatively, we have about 200 new referrals a month of people that are either on the streets or about to become homeless. We help out veterans with security deposits, first month's rent, back rent. If someone's car breaks down and they need to get to work, which obviously they need to pay the rent, we'll get that fixed. We have transitional housing. I know it's debatable with housing first. Some people think that's a dirty word, but it gets people out of the shelters because it's a step up from it. Gives them some breathing space to work on their goals, which when you apply to Social Security, veterans disability benefits can take some time. We have our HUD-VASH program, which is a Section 8 voucher for homeless veterans that everybody wants, as they should. And we also have project-based housing throughout the community. And we're very proud the Providence VA was the model for the healthcare for the homeless for the other VAs throughout the country that was set up back in 2008. Thank you.
Thank you. Questions? Okay, we're going to go back to the Department of Human Services.
Thank you. Sorry about that. At the Department of Human Services, we see around a third of individuals in the state each year through our doors. We partner with many folks in this room around the services that we deliver for supplemental nutrition assistance, our Rhode Island Works program, child care. We have all of the Medicaid programs that we assist customers with eligibility determinations, the long-term care, long-term services and supports. We work our case managers, I would say, in our Rhode Island Works programs and our economic support services programs really do a lot of case management with individuals coming in on those programs around homelessness and what services we have that can help support that. We listed a few here around emergency assistance, programs that have been in place with the agency for many years, support for families facing any catastrophic issues around fires, unsafe living conditions. Again, that's managed through our Economic Support Services unit now. This includes some shelter, and if there's any replacement of items that come from that catastrophic event. We provide integrated support. Like I mentioned, we combine housing assistance as we're determining eligibility for our main programs around supplemental nutrition assistance, Rhode Island Works Medicaid. We have energy programs for live heat and weatherization that are also provide benefits and services to customers to help prevent the unhoused event. We partner with many folks in this room. We can't get this done, so collaboration is a key point in this work that we all have ahead of us. So we collaborate with CAP agencies, Crossroads, and there's a tremendous amount of folks that we partner with to ensure that we are delivering services and supports to our customers. We try to always use data to make decisions for our programs and enhancement. One of the things that we want to get more involved in is the Homelessness Management Information System and linking our programs, some of that data, or linking our work into that data collection. I'm going to ask Donna to talk about our Housing Stability Services pilot.
Yeah, so we are very much, the Department of Human Services believe that it's part of all of our missions to help resolve homelessness and stabilize people homelessness. This is one of two major barriers for all of our families that are coming through our doors. We have been engaging in a capacity building. What we did is we sent funding through to our partner agencies in order to at least create the no wrong door and to build the ability for us to get money to those people to stabilize their housing. We are building it as we fly still currently. First few weeks, we sent over $100,000 out to the street to help stabilize housing. We are trying to be as innovative and broad as we possibly can. Like the last request we got was for a license restoration. Anything that's going to help that person continue to work and maintain that housing. So we are continuing to build that capacity. The director putting more staff in that economic support unit as well. I want to say that we are also continuing to go out to the community partners, and even we are looking at putting in an eligibility technician for a limited amount of time over in DOC's reentry program in order to screen those folks. And included in that screening is all of our services, but also including our housing stability pilot. So we are still building, and we are noticing that each day more and more applications are coming in. So we're very excited about that opportunity. And again, this particular funding is coming from kind of block grant, so that is for families. Just want to point that out. And I thought that was going to limit, but it seems like that our ability for who we could help, but the number that's coming in is consistent, I guess, with what we're all reporting. So we're happy to meet with anyone that wants more information on that or needs to know what the process is for. Questions? Yes.
More a comment, because I was remiss in recognizing the partnership we have with DHS and what we're doing with Donna and her team around the housing stability pilot and services and the funds that they're able to provide us when we hook our families up to those services to offset that $7 million, a tremendous amount of funds to offset that $7 million that we're spending.
Department of Health.
Okay, thank you. Basically our work is sort of in three buckets, I would say. One is foundational, and that is looking at the social determinants of health through the health equity zones, through our department, our division of community health and equity. There, I've said the dangerous word twice. It's really looking at the social determinants of health. Rhode Island's been a leader in this for the last 10 years, and looking at localized vulnerability and trying to address what is driving those vulnerabilities. Primarily, it is partnering with community-based agencies or agencies, to drive programs to address chronic disease, homelessness, substance use disorder, all of the things that actually drive people's social descent, if you will. That's our main thrust of activity. A really important part of that is supporting our community health workers. The other two things that we are doing, so we collect a lot of data and are able to analyze that and share that with other agencies in order to inform the work that they're doing about the social determinants of health that again has such an impact on homelessness. And then lastly, we are also always coordinating with FEMA and other agencies around emergencies, whether they be environmental or otherwise, that lead people who are homeless into greater vulnerability. So I won't sugarcoat it. All of this is under dire threat, and I do not know what the future looks like. Thank you.
Thank you, Doug. Questions? Okay, we have got 5 minutes left, so I want to open up for discussion. I want to start that discussion by saying that clearly, even though a number of people said we don't deal with homelessness, it's not our charge, everyone here is dealing with homelessness, one way or the other. It's also very fulsome, and I was going to say rich, I don't mean to be perverse. The set of resources we currently have, current efforts, but even knowing where all these are, if and when some of them drop out, to know what's dropping out and know where we've got to try and move will be, I think, really essential to maintaining our collective efforts. We at the department will try and take a stab at pulling something together that creates a map of these resources. We also want to work with EOHHS to find out where those that are falling into homelessness have touched the system. I'm sure they've touched the system in a number of places. What can we do to better catch them? A lot of good programs out there, obviously, but prevention is going to be the key with what's probably coming from Washington. So with that, open it for discussion. We have about 30 minutes.
I would like to speak because I'm very upset. I've been working all my life since I was 16 years old. And because I was in a car accident and ended up in a nursing home for 4 months, I lost my house and then became homeless as of 2017. I am not a drug addict. I am not an alcoholic. I am not mentally unstable. And this is what you all people seem to think everybody is that are out on the streets. And it's not true. What if it was your child or your grandchild? How would you feel? You tell me. How would you feel?
Ma'am, I don't want anyone to be homeless, and that is the
Well, I've worked all my life, so why should I be?
And
you shouldn't.
And there's no help. You go to CES and you connect 14 mice in your room, and the windows are nailed shut. Is that correct? Would you like to live like that and get searched every time you come back to your room? That's what I had to live with. And I've never been a criminal my whole life. I worked in the medical field my whole life.
And I think we absolutely understand poverty, not even poverty, the lack of affordable housing, the lack of being able to afford housing is the strongest contributor to homelessness. I agree with you. It's not because everyone's a criminal or a drug addict or any of those things. It is the cost of housing. And that's what we need to address. We need to get people sheltered and safe as a stopgap, and we need to increase our supply of housing.
And what about the baloney about the pallet houses? I build pallet houses. I can build one in 2 days, and I've offered it, and I got no help.
That's right.
No help. Okay. I've offered to give it for free. No help.
Thank you. Thank you. Going to wrap up with a few minutes of conversation within the agency council. We will not have time for public comment today. Melina.
Yes. My apologies. My apologies for the HRC not having a slide. I think that might predate.
A little louder.
I was curious, I think, historically, when we look back, we really haven't had coordinated strategies or resources for homelessness prevention. I think everybody's, doing what they can, but there hasn't been the coordination, and there hasn't really been targeted resources specifically for that activity. Obviously, we're building housing. Clearly, we're not building it fast enough, even though I think we've made really significant strides, particularly over the last 4 or 5 years. But I was curious in the discussion, I'm hearing everybody talking about the touch points on people being homeless, and I appreciated Department of Labor collecting the data around the RI jobs, but is there a way to actually define, if you really want to do prevention, we need to get to people before they're self-identifying as at eminent risk? And I do think, based on our work through the Housing Network, sometimes people struggle to really identify what their vulnerabilities are until it's at the door, which makes it very difficult because the system is slow to respond. So curious if there's a way to develop a at-risk assessment that could be integrated in all of the touch points that might really include questions, for people to do some screening. Are you, living paycheck to paycheck? That would help us really understand where do the interventions need to happen, and not wait so much until folks are it's tomorrow, or it was yesterday, because I think what we can acknowledge is our system isn't well positioned at the moment to respond at that level of urgency. We need a lot more runway, but I think that's sort of our responsibility to build in the runway. So, thank you.
And to that point, actually, Ben has raised it in-house that if we look at where we're touching people, can we start seeing ahead of time? We know, but I think having some sort of standard assessment, and I'm sure these assessments are being used in some of these programs already. But again, collaboration, so we're all speaking the same.
Yeah.
Would be very
Motion to adjourn? Motion to adjourn?
Excuse me,
We're not taking public comment.
it's not public comment, it's a request.
Talk
A
about
good number of people have been waiting outside since 7:45 to be able to participate in this meeting, to bring the truths of reality to what you're talking about, street reality, and I would respectfully ask that you allow 15 minutes extension of this meeting to be able to hear the public comment.
I got a motion to adjourn. Can we extend for 15 minutes?
I'll move to extend for 15 minutes.
I'll second that.
Thank you. Before we leave, next month's meeting at the Providence Library. This room's not available. Okay, we're going to skip the conversation.
Next week's meeting, I don't know how that room is set up, but can we set it up so that we're facing folks behind us? I mean, we're behind me, but.
Right.
We'll move off the conversation about what kind of work this group can do in the future, which is the next projects. We'll move that to the next meeting, and I will open it up for public comment. I have a list here, so I will start with Bernie Bedreau.
I respectfully defer to Eric Hirsch, who's been our leader in this work for more than 3 decades. And Eric, go ahead.
Oh, thanks, Bernie. So people are extremely upset that people are dying outside.
Yes.
As Karen said, maybe you saw that as an interruption, but Karen was telling the reality of what's happening. That someone froze to death on North Main Street at a bus stop. And this was during the point in time count, and the people just walked past him because you're not supposed to disturb someone who's sleeping, but he turned out to be dead. So there are at least 2 other people who also have frozen to death. So we don't have enough shelter beds. We appreciate that we've kept the 1,400 plus shelter beds. So that is important. We appreciate other things like Charles Gate being purchased. We think the state should continue to own that, by the way. But
we absolutely need certain things now. One is, why are warming centers closing when it's 15 degrees out at night? I'm not sure what is the criteria. How about if we make it 32 degrees Fahrenheit, wind chill or temperature? Anytime it goes below that, they automatically open and stay open. Because they're opening and closing, opening and closing. One time they were closed, it was 15 degrees out that night. So we need that. We need to make sure that people know these warming centers are open. We need outreach to them. The government is just not doing enough here. We had to open the Da Vinci Center as a warming center. We had to staff that. One of our outreach workers, Amy Santiago, was out the whole day getting people in there. Then she stayed up the whole night supervising it. Then she was out the next day. Then she pulled another all-nighter that night. One of my former students has 100 people in hotel rooms. He's funding that through a GoFundMe page. I could send that around to people if you want. Why isn't the state doing that? This is an emergency. This is an emergency. If people were flooded out, if people were burned out, we would actually be responding to that. But because they're homeless, this has become institutionalized. Oh, there are hundreds of homeless people outside. Guess what? In 2019, there were 71 people outside. Mainly due to COVID, now we had 534. We had 534. So we need more action on the part of this council. I know there are people who care. I know many of you. But let's act, not just talk. And you need to found that advisory council, people from the community, people with lived experience, people who are actually homeless, like Karen, like Phyllis, like many of the people sitting here. That's what we need to do.
Thank you.
Oh, me? Oh, I didn't think I was that high up. I just have a few things, sorry. Yeah, I'm glad to see that we're moving this to public library because this venue continues to be inadequate. It does not have adequate amplification. Heavily policed public meetings are sparsely attended public meetings. Right. There could be many more people here, but they're not going to go through that gauntlet of police. They might not have an ID ready. There are many reasons why they might not be here. I want to point out some comments based on things people have said here. One thing, elder adults are among the fastest growing population experiencing homelessness. Families with children are among the fastest growing, and we heard from the Department of Education about the problems. The Department of Corrections routinely releases people into homelessness. Turning people over to Crossroads, Open Doors, and Amos House is an admission of this. It's not a positive thing that we're saying, you're out of jail, go to Amos House. That's not even close. The Lieutenant Governor is currently in Israel, a country responsible for rendering hundreds of thousands of people homeless last year. Listening to the, what else do we have? Oh yeah, listening to the Department of Education, it seems like ending child homelessness might increase school attendance, which is something both your boss and the governor, your other boss, are really interested in, supposedly. Also, getting them free meals when they get into those schools would also help, but I noticed that's not in the budget. Speaking of the budget, the governor cut budget money for homelessness by $20 million. You can check with Sam Bell if you have a disagreement with that. I think, in my opinion, there's no indication that the McKee administration takes the issue of homelessness seriously. The Interagency Council ceased functioning shortly after McKee became lieutenant governor, demonstrating that he has never taken this seriously, in my opinion. And the Trump administration is attempting to stop funding. It's an existential threat for many of the groups here and throughout the state that's supposed to help this. And I don't think anybody in this room is prepared for that. And you might really want to start thinking about what that preparedness looks like, because people in this room are only a fraction of the people who are going to be extremely angry when homelessness starts to rise and when these services are cut off. And they're going to come for your jobs. Thank you.
Rebecca Carr.
director of the street medicine program. Thank you guys. I appreciate all of this. Thank you, Eric. I'm frustrated that this meeting, which is held in January at the height of all of like this extreme need outside, is focused on, you know, what are these two columns? What role does your organization play and what resources can you bring? Like, we're not here because everything's working and we just need to know like what all you guys are doing. We want to know where the gaps are and where the need is. And still, like, you know, this meeting and last meeting, there's no discussion of what the actual data in terms of need is and where we're falling short. And I would just like to suggest that in the future that these meetings it's okay to say, because we all know what's happening, like, here's where we're falling short, and here's what we need to do better. We need more money, we need more whatever, you know, like housing. We know there's not enough affordable housing. How much do we need? How many more apartments do we need to house people? We know there are, you know, we've gotten 900 recovery beds. How many more do we need? Like, who didn't get beds and why? Like, where are all these gaps? And if we're just gonna like go around and talk about what everyone's doing right, like, that's not useful to us right now. So I just, in terms of how you're gonna structure the next meeting in a way that's gonna make it like actually effective, like I think focusing on those things and forcing people to focus on where these gaps are is really important.
We have 2 minutes left. I'm not sure I'm going to say this right, Bruno Martin. Last name Martin. Phyllis Stoll.
I'm Phyllis Stafford.
Phyllis?
Stafford. Go ahead, stand up.
Yes.
Okay, so last time I was here, I had a really bad bruise on my face and looked really terrible. This time, I would like to draw your attention to this. This is unbelievable. We have all these people here. It is such an unbelievable waste of money. It truly is. The basic things we need. Why is there a 4 or 5 year waiting list every time you apply for any kind of housing in the state? You are never going to get it. Okay, I've been waiting 8 years. No one has ever called me. I'm constantly trying to find it. It's not there. The Celsius Fahrenheit is a ridiculous thing to focus on. It is not a matter of what the degree temperature is, whether it's Celsius or Fahrenheit. It is unbelievably cold. And with the wind chill factor, it's ridiculous. I waited outside for 1 hour and 45 minutes to get a bus to come here. I really thought, how are people surviving like this? It's really ridiculous. And you keep saying, oh, you guys are all working great, doing your thing and this thing, and I know it's multifaceted, but you have to do something. You cannot just sit and talk to each other about what you're doing that's great, okay? We need beds, we need apartments, we need affordable housing, and you can't just take a shovel and tomorrow say, oh great, we're going to build this. We're looking at 2 years down the line. What are you doing right now? This is what you need to focus on. We don't really care all the help you're giving each other or the statistics you require, because they're not accurate, okay? People don't want to be counted. They are out there dying. I don't understand why this is so difficult of a concept for any of you to comprehend. It's atrocious. It truly is, and it's inhumane. You can't open a warming center and tell somebody to sit in a chair for 15 hours. You have no idea what that's like. It is so uncomfortable and so ridiculous. You have to have beds in these warming centers. If not, don't even bother opening them, because they're not helping anybody. It's really aggravating to us and very upsetting when we go to meeting after meeting after meeting and we hear the same things from all of you, all your little things that you do in your little groups. We're done with that. And you're supposed to be the director of housing, and what are you doing?
Thank you, Phyllis. And the last speaker is Pamela from Poor People's Campaign.
That's me. So, this is a crisis.
Yes.
And the last time we were here, you guys, well, those of you that were here, and by the way, I'm not sick. I am getting.
Oh no, I just want.
I know, but I'm coughing up the lungs. So I'm really sorry.
No, that's quite all right.
That's why I have a mask on, because it won't stop. So last time we were here, not all of you were, but we were, there's a lot more of us. Because it was at 12:30. And it was easier for us all to get here. And I made that comment to someone who was here. When they said, oh, let's do it early in the morning. It'll be better for us. Great. It's not better for the people you need to hear from. And you need to hear from them. Because this is a crisis. And having a meeting, monthly meeting, is not what needs to be happening right now. This should be happening every week. Even if it's just an email chain that goes around every week to say what you have found out, what you can do, how you can make a difference. Because you need to make a difference now. We have been screaming about, at least I have for 4 years. Before that, I worked all my life. Then I got disabled. I became disabled. I was homeless for 3 years. I was on that list, Rhode Island Housing. And I'm sorry, it's not your fault, you personally, but they told me, oh, I'm sorry, it'll take 2 to 5 years. Oh,
That's average.
so I didn't get in until 3 years, and only because the person I was living with does a great job at writing emails and making it very clear that this needs to happen. But not everybody has that friend. So most people are out on the street, and we are at over 600 people right now.
Right now.
That is absolutely unacceptable, and we cannot accept that. You know, we are overburdening our emergency rooms. We're overburdening everybody because we don't have housing. Number one, we've got to start getting housing. And you just had the Johnston mayor decide that you would use eminent domain to get rid of 252 proposed housing units. This has to stop, and you've got to work with everybody. The governor has got to start getting involved, and he is the one that stopped it. In 2014, Steve, when did he stop it?
This agency stopped it shortly after he became lieutenant governor.
He stopped it. He has got to care about this. He is not going to be in office in 2 years if he doesn't.
I just want to also remind folks that actually the governor restarted the council.
After 8 years. After 8 years.
With a lot of
He didn't do it when he was lieutenant governor, and neither did Sabina. This is appalling. You've assembled public officials who have taken an oath and are dedicated. Where is the strategic plan that called for this body? And where is the unified command? Where is the unified command? And EMA should be governing that. You have assembled these people for a charade. I apologize to the public officials. Your duty is to have a strategic plan to end homelessness. This is a charade. She's here from New York City after a corrupt operation. 70 people were indicted while she was there. Rats, 53,000 rolled cases, defied federal court order. Governor Cuomo was going to take over the New York City Housing Authority. She should withdraw. She's a disgrace. Thank you.
Thank you all.
Bullshit.